Imagine your child needs to see a doctor. You're thinking it's not quite an ER visit, but it feels like more than a normal checkup.
Yeah, well, in today's Eye on Health, families in Wexford have been watching the growth of Allegheny Health Network's Wexford Hospital over the last couple of years. And recently, another new addition was unveiled.
AHN Wexford has expanded their pediatric inpatient services. We're talking kid-friendly rooms and emergency department readiness should it be needed. Daisy stopped by to give us a tour.
Good morning, everyone. Well, I am here at AHN Wexford, where they have actually just expanded their pediatric services, and I'm really excited to be able to give you all a tour of what they now have to offer. I'm here with Dr. Clapper here, and you know, there's a lot of changes that you guys have made, and why is it that you decided to do this?
Good question. We've noticed since we opened the hospital 2 years ago that there's been a tremendous need to keep care in the community, and pediatrics in particular. As the obstetrical program has grown, over these past 2 years, we're seeing families that want to bring their children and their kids to the hospital to be evaluated for emergency care and emergency services, and that's grown. I think roughly right now about 10% of our ER visits are pediatric patients who are coming to be evaluated. Many of those kids we can manage and take care of, but some of them may need a little additional care, and they may need a night or two to be in the hospital. So with that in mind, we decided that listening to what the community needs, we would expand our services and programs. Prior to opening the program, we were managing patients from 18 and up. So really the addition stretches and expands that limit from birth until 18 years of age.
Well, I love all the colors in this hallway. Which is the first room that we'll be stopping in first?
We're going to see the playroom.
Okay.
And some of the unique things that we did for different age children.
Wow, Dr. Clapper, there's a lot of activities in this room for kids of any ages.
Yeah, there are a lot of different options. You know, we have spaces where older kids can, color and interact with their parents. We have an area for toddlers. We have different types of toys and coloring options for different age groups. A lot of different activities for the kids to stay occupied. So each of our rooms are capable of managing children from obviously newborn up to 18, and each of those age groups have different needs. You can see here what we've done for our infants with a crib that you can attach multiple different toys to keep those infants entertained. We have a milk refrigerator for moms that are breastfeeding that's lockable, and we have a play space with a play mat and different toys for our infants so that the family can interact with their children.
Yeah, it really seems like they have everything they need, that while they're getting the care, they can still enjoy and help them to grow and play with their own child.
Yes, yeah, it's important that we de-emphasize the hospital nature as much as possible.
Love it.
It's like a light show.
Yeah.
This is, these tools are used to help patients who need a little extra attention to help relax. You have a weighted blanket. We have, this light show, bubbles, and different lights to help focus on and distract a patient from their surroundings and environment. It's just a nice way of calming and relaxing our patients who may need a little bit more attention.
Well, Dr. Clapper, I think this is an amazing opportunity for all of those that you serve in this community, and thank you so much for giving us the tour.
Thank you. We're so happy and so proud to have these services available to our patients.
I agree. Well, we'll send it back to you guys at the PTL studio.
Yeah, of course the medical care is impressive,
Yeah.
but just those lights that we were talking about, to distract the kids so they don't even think they're where they're at, you know? It's really important.
I think it's too hard. It's hard when kids are aware that they need to go to the doctor.
Yeah.
Not when they're an infant, but when they're a little bit older, and having to go there can be scary. So knowing that there's comforts and toys and lights and things that are going to keep them distracted. Yeah.
Well, some of the specialties there are high quality orthopedic care, ear, nose, and throat care, and inpatient care for children with acute medical conditions.
And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.